I lost my sister to heart disease.
Life can strike at any moment.
If I would have known.
Come learn what you don't know.
The emergency room is more popular than any app store or theme park. It has one of the greatest impacts on life and death. With numbers still climbing, the ER sees about 129.8 million visits per year.
Hi everyone, my name is Carl Nicolo. I've been practicing medicine for 25 years now. So primary prevention, I'd like to illustrate with this real-life example. Not long ago, a patient's wife called me and said, Dr. Nicolo, my husband's been having chest pain for 3 days. He doesn't look well, and unfortunately he had a massive heart attack. I know that this patient had all of the risk factors: diabetes, high blood pressure, high cholesterol, insufficient activity, and he was a high risk for heart attack or even a stroke. But the wife didn't know that.
About a year and a half or so, I had developed chronic headaches, sinusitis, lower back pain, and I really didn't know what was going on. I started to gain a lot of weight.
One needs a minimal amount of knowledge to have a sense of what's going on. Primary prevention means to intervene before the patient has a heart attack or a stroke.
I spoke to the doctor concerning this, and he made me go through a thorough evaluation. I started to lose a lot of weight. I was feeling so much better from inside out. And the reason this happened was because of awareness.
Health awareness is important to me, mainly because just being aware usually prevents the worst from happening. Like, life can strike at any moment, and you've got to be prepared, and that starts with being aware. My father was admitted into the hospital for pneumonia, and of course the doctors didn't tell us otherwise, so they gave him medication and treatment for pneumonia. And we thought it was helping, but we got a call saying that he had to be transferred to another hospital. And once we got there and we spoke to the specialist, it turned out that the medication was actually making things worse because he didn't have pneumonia. Somebody that was very important to me died because we didn't know what was going on. And it's hard, but just being aware definitely would have helped. Knowing what was wrong could have definitely saved my dad's life. So Health on the Rise is definitely making the difference to help change that. Just being aware makes a difference.
As a football player, we sustain injuries that we have to live with for a lifetime. But what happens in the long run? What happens years after college when you get older and things start to come back? Going through the treatment, the physical therapy, you think, okay, it's a resolution. You know, you're gonna be healed, you don't have to worry about it. You never worry about or think about what happens after. Health on the Rise is an opportunity for me to get help, get medication, get treatment for it, so that way I can live pain-free for the rest of my life. Without medical insurance or coverage to get treatment or help, what can I do? That's what Health on the Rise means to me. The opportunity to take care of myself for the longevity of my life, not just for right now.
But Health on the Rise saved my life through education, through awareness.
We need your help. And with one donation or financial gift, you can help supply the information needed to save someone's life. And who knows, that someone could be you. What are you waiting for? Take action.
Health on the Rise, saving lives through awareness.